Malaysian Medical Relief Society (Mercy Malaysia) was established on 16 September 1999 as a non-governmental organization (NGO) and registered with the Societies Act 1966. The vision for Mercy Malaysia is to excel in the delivery of medical and humanitarian assistance to all. While the mission for Mercy Malaysia is an international non-profit organization but focuses on providing medical assistance, health-related development and risk reduction activities for revealing communities in both crisis situation and not crisis. The purpose of Mercy Malaysia was established is to be an organization with integrity, ethics, and professionalism that acts to know comprehensive information on a disaster that occurs. Therefore, Mercy Malaysia provides many benefits to the people with the humanitarian assistance provided.
There are two efforts by Mercy Malaysia by providing assistance in Malaysia and abroad. Mercy Malaysia efforts in Malaysia are in risky areas in Perak and Kelantan. Mercy Malaysia collaborates with the ASIA Foundation and provided a contribution of RM335,000 for the School Preparedness Program (SPP). This program is managed by Disaster Risk Reduction (DRR) Department of Mercy Malaysia. This program was conducted at Sekolah Bahasa Sri Kampung Laut with the presence of 4 teachers and 40 students. The purpose of this program is to educate children about the need of dealing with natural calamities such as floods, as children seem to be the most physically and emotionally affected by flood relocation. As stated, this program runs for 1 year with 2 phases, namely disaster reduction, risk workshop and activities. And second phase is more to refreshment program for future improvement. ASIA Foundation established this collaboration initiative to encourage improvements in Malaysians' actions or responses in disaster preparation. This program runs all year with the participation of 30 elementary schools from around Malaysia. Mercy Malaysia success reached 4 schools in Kelantan and Perak in August 2015. This program is expected to be completed by 60 teachers and 102,000 students to carry out more community sharing. Second effort by Mercy Malaysia is Ebola Recovery Project at Sierra Leone. In the 18 months since the Ebola virus spread over West Africa, over 11,300 people have died and most of them have been infected. Sierra Leone had to stop all schools for almost 1 year in order to break the chain of the Ebola virus. Mercy Malaysia, in collaboration with local partners, targeted schools in the western rural area in an effort to aid schools in recovering from the Ebola virus outbreak and ensuring children's safety and protection. This initiative is in collaboration between the Pekin to Pekin movement and Plan Sierra Leone, purposely to help school recovery from the Ebola virus while also encouraging hygienic habits in schools to avoid virus transmission. Ensure that all teachers and students are adequately prepared to avoid Ebola infection. Most of the schools have benefited from the delivery of meal tanks and hygiene kits. As stated, all the accomplishment while the mission was going. Both school management committee members and teachers have received training in disease prevention practices. Hence, the majority of the initiative have directly benefited 1,018 instructors and 108 school management committee members, as well as 5,400 students. Indirect beneficiaries include 50,985 school children. After all, these two efforts done in Malaysia and abroad are good for the development in terms of altogether giving hand for the sake of humanity.
So in my part, I will talk about the contributions of Mercy Malaysia to the development administrations. As you can see here in this slide, there is a 3 main contributions of Mercy, which is the first one is Mercy Malaysia provide humanitarian assistance to those in need. Mercy Malaysia has offered humanitarian assistance and programs in 32 countries in both crisis and non-crisis situations during the previous 2 decades. Mercy Malaysia has also grown into a full-fledged humanitarian organization by providing a wide range of services ranging from disaster relief to rehabilitation and recovery, mitigations and preventions, and disaster preparedness. Following that, on May 21, 2015, Mercy Malaysia has provided humanitarian support to human trafficking victims of the Rohingya and Bangladeshi ethnic groups detained at the Belgian detention center in Kedah. In other words, if a natural disaster occurs, Mercy Malaysia is the first responders and rescuer. The emergency response base is also a crucial, life-saving step to ensure an effective reaction when a crisis strikes. Next, Mercy Malaysia also established a medical team and provided medical assistance. Mercy Malaysia has dispatched numerous medical teams to aid individuals in need. As an example, for earthquake victims in Nepal, they have been assisting disaster victims by treating disaster sufferers. Mercy Malaysia has also dispatched 5 relief missions to Kosovo, which is located in Europe, to aid and care for individuals in need of a natural disaster relief, which all volunteers are certified as medical personnel, including physicians, assisting health officers, nurses, and health inspectors. And last but not least, the contributions of Mercy Malaysia is they collect and deliver donations to the needy. In example, there are Seringgit Suari initiative under the Mercy Malaysia that has support the work of Mercy Malaysia in offers humanitarian and medical aid to underserved populations both locally and worldwide. The Malaysian Medical Relief Society, or Mercy Malaysia, has made numerous grants to those in need, like more than Rm 1 million has been donated to those in need by the charity. In May 2014, for example, Mercy Malaysia has spent about Rm 5 million to assist Gaza war victims. They are appealing for donors to assist and support the humanitarian expeditions that is being arranged. Mercy Malaysia has also made significant contributions in a variety of forms, including financial and critical goods, as well as food and beverages supplies for the need of the people.
Mercy Malaysia has spent a lot of time and effort helping individuals in need in the past. The existence of this organization has brought joy to the people in any scenario. Their services and assistance are not only limited within Malaysia, but they have also traveled or crossed borders to other countries to extend assistance as little as possible. In this situation, there will definitely be some challenges for them. Several examples have emerged where the activities of the Mercy Malaysia organization have become difficult. For example, in Myanmar, all Mercy Malaysia volunteers had to travel more than 2.5 hours by speedboat from Sitwe to bring aid to Rohingya refugees affected by the disaster in Mang Dao, Rakhine, Myanmar. They have managed to supply aid to 1,200 households in 4 devastated villages in Mang Dao. Mercy Malaysia has provided more than 10 million ringgit Malaysia to a humanitarian initiative in Sitwe, which also involves the operation of 10 static clinics and field clinics in Myanmar refugee camps. Mercy Malaysia will focus on healthcare programs, food distribution, child and maternal nutrition programs, as well as water and sanitation initiatives in Mang Dao. Finally, Mercy Malaysia will provide emergency generator support to Mang Dao Hospital to help reduce conflict in the northern district of Rakhine. Not only in Myanmar, but also when Mercy Malaysia is helping Nepalese people affected by the earthquake. While operating in Nepal, they face transportation problems as well as issues arising from the disaster area itself, which are impossible for them to get into it. Mercy Malaysia is not expected to face difficulties in approaching the affected territories due to the ongoing chaos from the tragedy. Many roads were badly damaged by the quake, leaving all vehicles unable to access the affected areas. Because of that, they took the effort to go slowly for a 3-hour tour. Unfortunately, they barely reached as far as 15 kilometers and were unable to enter the hinterland due to the several destroyed roads. According to reports, hospitals in Kathmandu were no longer able to handle the injured earthquake victims, and others had to be treated by the roadside. According to the statement of Vice President of Mercy Malaysia, Dr. Heng Aik Chang, the Mercy Emergency Response Unit ERU team that landed in Kathmandu has been stationed in Ipatul, Shangku, and has set up a mobile hospital there to serve an average of 250 patients per day. The ERU team consists of 28 medical and logistics staff and is equipped with a field hospital to serve and treat earthquake-hit areas. They estimate the service will take at least 3 weeks and possibly up to a month, depending on the situation in Nepal. The third challenge is the lack of volunteers cause funding difficulties. The challenge faced by Mercy Malaysia is the declining number of volunteers resulting in difficulties in making funding. It can be seen that Mercy Malaysia lacks volunteers when the number of volunteers from 7,000 people in 1999 decreased to 2,600 volunteers. The funding issues faced by the Mercy Malaysia organization were exposed as this caused them difficulties in providing emergency medicine, rehabilitation and post-disaster reconstruction. Therefore, the Executive Director Amran Mahzan hopes that the Mercy Malaysia organization can raise 500,000 ringgit Malaysia to provide assistance such as providing food packs worth 250 ringgit Malaysia to families living in hunger. Next, I will present about some suggestions to Mercy. The first suggestion is that Mercy should collaborate with the education sector. With this, Mercy has the opportunity to get closer to the young people through the organization of programs and activities related to this association in order to attract young people to join the Mercy. In addition, through the program as well, Mercy can provide a basic training as well as support to the young people who want and have joined Mercy. This is because young people are the one who will continue the legacy of Mercy in the future. The second suggestion is that Mercy needs to strengthen and highlight their association better on social media. This is because through social media platforms, Mercy can promote about the functions of their organization, teach how to join their association, share ways to reduce disaster risk in the country, provide a medium for community to easily donate, find out current issues about areas in need at an immediate rate, and more. Here it clearly shows that Mercy can reach out to more people regardless of age through social media, as the community is now more active in social media than participating in organized program. Finally, Mercy needs to conduct training and skill upgrading program every 4 months for their volunteer members in order to produce the members who are more skilled and agile in providing assistance to victims. In addition, with a program like this, they can learn how to control their emotions so that it is not easy to give up while providing assistance to the victims.
In conclusion, Mercy Malaysia is a non-governmental organization (NGO) that assists the government in matters involving natural disasters, medical and more. The assistance is not for profit to organization but to have communities in need such as flood victims, the poor and more. Hopefully, the charity work done by Mercy Malaysia volunteers gives awareness to all communities about the importance of caring for people in need and attracting young people, especially to join Mercy Malaysia volunteers. We have a declining number of members. Thank you.